like so many people struggle from patella tendon pain, and obviously Achilles as well. But nobody really focuses on that. It's people who like consider it as like an afterthought, but like nobody specializes it. So then people like me who are coaches day to day, I can go to somebody like you who's a specialist, and I got a list of specialists where I can go learn from each individual topic. I think it's so necessary.
Yeah, and it's like we were talking earlier about like the non-interventionalist people we probably are, because I'm like, there's no prehab for patellar tendinopathy and jumper Z.
Mm-hmm.
If you don't have it, just go play.
Yeah.
Go play and probably do some lifting, because lifting is good. And but if you don't have it, don't concern yourself. Don't be like, I need to do X for my patellar tendon prehab and then X for my Achilles tendon prehab. I'm more of the line of thought of like, you're out of the package, ready to go play. So go play. And if it comes up, then we step in. But this whole fear thing of like, I don't want to do too many jumps because I get patellar tendinopathy. It's like, you don't know if that's ever going to happen, and it probably won't happen. And most cases, it kind of just clears up as well. So the non-interventionalist too is people get patellar tendon pain for 1 or 2 days. Like, hey, I want to get your jumpers in your protocol. It's like, don't, just rest for a little bit.
Yeah.
Do some common sense, and it might go away. You don't actually need to rack your brain with trying to understand the patellar tendon, because most of those just go away. It's those cases where you've had it for months or maybe even years where, all right, you got to dig in and you got to scrap everything, and we got to change the program. But
sometimes with the prehab stuff, people become so obsessed with, like we were saying before, these little corrective exercises, and then they forget to actually load and get the patella tendon strong. Like that's the only way that you can somewhat reduce the risk, I guess, of jumper's knee coming on, is manage your workload, like just ramp up gradually. Don't do too much too soon, and stay strong, like stay fit. Yeah. Keep your body weight down. Like that's the only time that I have ever struggled with patella tendinopathy. If my body weight goes up and then I still go do the same jump volume, or I still go play basketball, at some point I'm either going to feel a little bit of Achilles on the left or a little bit of patella tendon on the right. But if my body weight is down and I don't ramp up too soon, I'm going to be good. So it's not something that I really stress about in terms of, like you said, prehab.
Is that